So, you've just had a total hip replacement. First of all, congratulations on taking that step. But now, these next few weeks, they're absolutely critical. Think of this as your game plan for navigating them successfully and really setting yourself up for long-term independence. And look, that's really the core truth we've got to start with. The single biggest factor in how well you recover isn't your surgeon or the hospital. It's how consistently you choose to move. It's a decision you have to actively make every single day.
Right, and I get it. That's the million-dollar question, isn't it? It feels like a total contradiction. You want me to move, but it hurts. We are going to tackle that exact problem head-on and give you a clear path forward right through that discomfort.
Okay, first things first, let's get real about why the stakes are so incredibly high here. This isn't just about feeling a little better a little sooner. This is about avoiding some really serious complications that are caused by one thing: staying still. Those first few days, they are absolutely make or break. And you might be asking why. Well, because staying immobile leads to a catastrophic loss of strength. I mean, look at that number. As much as 1 to 3% of your muscle mass can just disappear per day. We have to fight that decline from the moment you wake up. And it's not just about your muscles. Take a look at this list. We're talking about dangerous blood clots from blood just pooling in your legs, pneumonia because you're not breathing deeply, incredibly painful pressure sores. These are the real deal risks of being inactive. Movement isn't just exercise. It's literally your shield against all of this. So what's the takeaway? It's this simple sentence. If you remember one thing from this whole guide, make it this. Seriously, write it down, stick it on the fridge. Every single time you find yourself getting a little too comfy in that recliner, this is the mantra that needs to pop into your head and get you up. All right, so we've covered the why. Now let's get into the how. Let's talk about what this actually looks like and build a plan that's simple and manageable. This is your mission for the first 7 days after your operation. And this right here is so important to understand. Look, nobody's asking you to run a marathon here. The whole mission is just to get up and move often. You're basically reteaching your body that it's safe to move, and you're actively preventing all those complications we just saw. It's all about racking up those small, frequent wins. And here they are, your two most important tools for the job. First, short walks with your walker. We're not talking miles, just 5 or 10 minutes at a time, but you're doing this every hour or two that you're awake. And second, whenever you are sitting, you're constantly doing ankle pumps, like 20 or 30 every time you think about it. Seriously, think of these ankle pumps as your secret weapon for circulation, actively fighting off those blood clots. Okay, so what does this all add up to in a day? Well, the optimal target for your total activity in that first week is about 2.5 hours. And I know what you're thinking. That sounds like a ton, right? But it's really not when you break it down. Just 6 to 8 of those little 10-minute walks gets you over an hour. Add in your other simple exercises, changing positions, and boom, you're there. All right, let's talk about the elephant in the room, the pain. It's the number one thing that stops people from hitting that 2.5-hour goal. To get past it, we have to totally flip the script on how we think about pain and the medication we use to manage it. First off, let's just get this out of the way. The pain you're feeling, it is 100% real. It's not in your head, and it is genuinely tough to deal with. This guide is not about toughing it out or ignoring pain. It's about working with it intelligently. This is the big idea you really have to wrap your head around. It's called the pain paradox. See, moving is what causes that short-term healing discomfort. But sitting still, which feels better right now, pretty much guarantees you're going to have more stiffness and more pain down the road. You literally have to choose the discomfort that leads to relief. And here it is, laid out, plain and simple. On one side, you've got the temporary discomfort of getting up and walking, which leads to lasting, long-term relief. On the other side, the temporary relief of staying put, which leads to chronic, long-term pain. Every hour of the day, you're standing at this fork in the road. So how do we make choosing the right path a little easier? Well, it starts by reframing our tools. Think about it. Pain medication isn't there to make you feel comfy on the couch. It's a functional tool that you use for one specific purpose, to enable the movement your body desperately needs to heal. And honestly, this says it all right here. This is a real-world decision you're going to face over and over again every single day. If you need that prescribed medication to get your walk in, then taking that pill isn't a sign of weakness. It's actually the smart, strategic medical choice for getting a better outcome. Okay, so let's tie this all together.
The big picture is this. Every single day, with every small choice you make, you are literally building your future. You are actively determining the level of independence you're going to have in the months and years ahead.
Just take a look at this chart. The gap between the minimum column and the optimal column, that's not about being some kind of super athlete. It's purely about commitment. We're talking about the difference between, say, 5 short walks a day versus 10. It's a simple choice of frequency and consistency. And let me be crystal clear about what these two columns really mean. This isn't just a small difference in how you'll feel. As the research shows, this is often the difference between needing someone to help you with daily activities and living a completely independent life. Yeah, the stakes really are that high.
So, in the end, it really all boils down to this. Your recovery isn't something that just happens to you. It's something you actively build, one short walk at a time. The choice is yours, every single day. So the question is, which path are you going to start building today?